New Jersey is experiencing one of the worst flu seasons in the country. If you've been spared so far, you probably know someone who's had or has it, with cases surging earlier and faster than in the last 2 years. Health officials say hospitalizations are climbing and the worst of it is still to come. But they're reminding people that vaccines and standard precautions, those remain effective. Senior correspondent Brenda Flanagan is with me now in studio for a look at what's behind the surge and what you can do to stay healthy. Brenda, what can you tell us?
Hey, Brianna. So New Jersey is among a bunch of states hit hard early on by a surge of influenza cases, according to the CDC. This particular virus is influenza A, the H3N2 strain, and it's spreading rapidly across the country. The CDC has a flu view map that shows New Jersey and New York are among at least 20 states colored deep purple. That's the highest flu rate by the end of December. New York set a record, more than 72,000 cases in 1 week. Montclair epidemiologist Stephanie Silvera calls it a bad flu season that's getting worse here.
We're not at the peak yet. I don't think we'll be at the peak for another few weeks. And I think that we're seeing both the number of cases as well as hospitalizations increase. This time last year, we were at about 5,500 cases. We're already at around 12,000. So, we've more than doubled from last year. Hospitalizations are up. Last year, we were at this time about 127. We've already had 553. So we're seeing more cases as well as a more significant severity.
This flu season has been a bad season. We went through a bad season last year, so that now gives us 2 in a row, which isn't fun. So it is worse than most. It's not an emergency. We're not expecting things to get overrun from it. We're not talking COVID-19 type catastrophe, but it certainly is bad. An awful lot of people are sick, and unfortunately, people are ending up in the hospital, and some people are dying.
Now, that's Dr. Ed Lifshitz with Jersey's Department of Health. He says parts of this particular flu strain drifted. They mutated. But that occurred after drug companies had already prepared this season's vaccine. The new version of the virus is called Subclade K. Rutgers Medical School Dr. David Sinimo explains the vaccine still works, but...
So there's a partial mismatch with the vaccine. So every year when you make the vaccine, you have to prognosticate which types of flu are going to be out there. So this flu vaccine does cover H3N2, but the K subclade evolved later, has some mutations, and really isn't as well covered as some of the other ones. So we are seeing an increase in infections.
It is still possible that you can get sick even if you had the vaccine. But if you do get sick, it's not usually as severe. You almost never end up in the hospital. Death is much less likely, and you're less likely to spread it.
Now, the CDC reports only about 42% of Americans have gotten the flu shot this season. In New Jersey, about half of flu cases, at some 6,000 so far, have involved kids, from infants up to 18 years old. But it's mostly older folks over age 65 who've ended up in the hospital with this flu. People who've been infected can experience symptoms that include high fever, body aches, overwhelming fatigue, and a lingering cough, with the incubation period averaging just 2 days after exposure.
And the description is you kind of feel like you got hit by a truck. This is what distinguishes when you know it's the flu versus a cold or a run-of-the-mill cold. Run-of-the-mill cold, you feel kind of worn down, and the symptoms tend to come on slowly. But with the flu, the symptoms come on very fast. And when you lie down, you can't even conceive of getting back up. And that is really one of the hallmark differences when you know it's the flu and not just a cold.
Now, New Jersey requires certain groups to get an annual flu shot by the end of December. They include kids aged 6 months to 5 years who attend licensed daycares or preschools. Yesterday, the CDC recommended that flu shots, amongst several other vaccines, should be administered to children only after consultation with a healthcare provider. That revised protocol reinforces a populist shift away from vaccinations, as described by Burlington County Health Officer Holly Cucuzella.
There's been a kind of trend probably over the last 10, 15 years in a decline in flu shots that we have seen. When I've been here at the health department for well over 20 years. And when I first started here, we were doing over 2,000 shots a season. This season, we're probably on track to do about 1,000. Some of that does have to do with the fact that flu shots are more available. You know, you used to not be able to go to your local pharmacy or grocery store to get them, and now you can. And so there is a lot more, but there's also, you know, we've seen a downward trend in the positive attitudes to immunizations as a whole.
Now, in a statement, U.S. Health Secretary Robert F. Kennedy Jr., an avowed vaccine skeptic, said, after an exhaustive review of the evidence, we are aligning the U.S. childhood vaccine schedule with international consensus while strengthening transparency and informed consent. This decision protects children, respects families, and rebuilds trust in public health. Meanwhile, Cucuzella says her department's sponsoring 2 free clinics this week where anyone can get a flu shot, although they see mostly kids. And yes, she still hears some people claim that the vaccine gives you the flu, which is, to borrow a phrase, fake news.
The flu shot is what we call a dead virus. And so typically people that do get the flu after getting the flu shot have already been exposed to the flu, and it's just bad timing because when you do get the flu shot, it takes about 2 weeks to become effective to really ramp up that immune system.
I had a friend say, well, if I already got the flu a couple weeks ago, is the flu shot going to do anything? What's the point? I said, well, you know, you can get it again. You're not going to get the same flu twice. But here's a fun fact. There's multiple flus you can get this season. So yes, you can get sick with influenza, but different influenza a couple months from now.
Now, Dr. Sinimo says data from the UK show hospitalizations from this virus have peaked and are finally trending downward, but that's over there. That could be promising, but their flu season is weeks ahead of ours, Bree.
Yeah, and Bren, that's always the kicker, right? That you can get a virus more than once, different strains. We covered this one. What other strains are out there?
Well, that's the H1N1 strain that we're talking about, another type A flu, but there's also type B flu viruses. Doctors recommend that if you do feel fluish, talk to your healthcare provider about a medication like Tamiflu because it can ease some of the misery, but only if you take it early on.
Yeah, it's a critical window that you have to meet there, and far too many family and friends of mine missed that window this year and suffered through it. Brenda Flanagan, great information for us, as always. Thank you.
Bree, thank you.
Support for the Medical Report is provided by Horizon Blue Cross Blue Shield of New Jersey, an independent licensee of the Blue Cross Blue Shield Association.